Hi, my name is Bruno Gobato. I'm speaking directly from Brazil, and we are going to present today artificial intelligence for orthopedic surgery, more like for shoulder surgery. That's my specialty. I'd like to thank you, Dr. Ayepan, for this opportunity to share with you our findings and our research about artificial intelligence. This is an example of a artificial intelligence. This is a computer-created actor that is speaking some words about artificial intelligence. And the objectives for this presentation in the next slides are to show first some terminology and some basis for you to understand about AI. AI is artificial intelligence. Show how we can do and how can we make our own artificial intelligence, our own robots, and show how we are doing that, and show a free product about artificial intelligence that can be used for shoulder surgery, and stimulate you guys the understanding first of artificial intelligence and machine learning, and show how that can be done in an easy way and how we can create ourselves. First, we have to understand a little bit about machine learning. We humans learn from our experience, but computers need to be told what to do. And what is machine learning? ML, machine learning. Machine learning is to teach computers how to learn from experience. But in this case, experience is data. For example, here in the middle, we have a picture from a dog and a young lady. We know that that's a dog and that's a young lady, but they both have the same shape, you know? So for the computer that have never seen a dog and a lady, he may not understand the difference about these two pictures. And I'm going to ask here about this picture. What are the difference about these two animals? Well, we all know, and when I ask them for some colleagues, some say, well, this is sure a kitten, this is a small cat. Well, in the picture, we do not have the size of the animal. We don't know what size the animal is. We are inferring that as we know this is a cat, this is a small cat, and as we know this is a tiger, this is a big cat, this is a big tiger. But from the picture, we don't know that. They have both the same colors, they both have stripes, they have ears in their noses, they're both cats. But what makes them different from this picture? Well, that's not that simple to understand and to teach a machine, you know, because they are pretty much the same. As we know they are different, we know they are very different animals. And how we teach the computer? Well, we have to give the computer data. So the basis for ML, for machine learning, is to give data. But this data must be clean. What I'm saying that must be clean. We have to prepare the data for the computer. So we have some types of machine learning. One of the most that we use more is the supervised machine learning. So what's a supervised machine learning? I'm the researcher. I know what is the input, the features, and I know what is the output. Let me put an example. I show the computer a picture of a dog. So I know it's a dog. And I show the computer and I tell the computer, this is a dog, okay? The same I will do with cats. Computer, this is a cat, okay? So the algorithm will find their ways, and most of the time we don't know how they use it, but it will find some similarities, and after that it will predict when we show a different picture of a dog, if that's a dog, and it will predict if that is a cat from a different picture. So first we train the machine learning. So we give pictures or we give data from dogs and cats, and we say these are dogs and cats. And then we give the computer, the algorithm, image that he has never seen in his life, and then we do the testing. Sometimes we have our data, we give 75% of our data, we do the training, and then we test with 25% of our data if our machine learning, if our artificial intelligence is smart enough to identify, for example, a dog from a cat. But of course, we are doing a little bit different than that. So when we speak about artificial intelligence, is a big picture, and machine learning is when we use artificial intelligence with statistical tools, with statistical data to provide better understanding about some subject. As we mentioned, we have 3 types of machine learning. The supervised machine learning, I have just explained to you, the dogs and cats pictures. We have the unsupervised machine learning and then reinforcement. Very simple. This is an example that I did in my home computer. I choose 3,070 images from my my clinic, lots of different images. These are all patients, and I told the computer, the machine learning, well, this is a hip AP view, this is a hip arthritis, this is a knee arthritis, this is a normal knee, this is a normal shoulder, this is a normal this is a fracture, and then we are going to test with images that this machine learning have never seen. So I have downloaded from the internet pictures that my computer, my robot have never seen, and then we test if that is accurate. In this case, he's 100% sure, the robot is 100% sure that this is a knee and it's correct, and he's 100% sure this is a normal AP view of a knee. Now a hip, he thinks it might be a hip arthritis. He understands that's a hip, that's okay. And he thinks that might be an arthritis and he's not sure. In this case, he's sure that's a shoulder and it's sure it's a shoulder arthritis. Let's continue, another example. In this case, he's pretty sure that's a knee arthritis and it's a knee. Well, he is okay, he is all right. And he's pretty sure this is a shoulder proximal humeral fractures. So in this case, he is correct. And here he has some doubts about the knee arthritis, and here he's pretty sure this is a shoulder arthroplasty. We can teach the model to understand movement. This is me teaching a machine learning how to understand how my arm is, if it's full elevated, 90-degree elevated, 6 degrees. This is another way to teach a machine learning. And this is an example that you can try at your home. In this QR code with your own phone, you can test. This is it's a simple machine learning with few images that you can test. More like to test if the machine learning can identify that that's a hip and that's a knee. So that's a very simple machine learning that you can test at your own home with this QR code. And here we are testing, showing how can we test. We drag and drop some image from our computer, and we see if the machine learning and this robot can understand about this image. You know, this is not correct, it's just for testing, and in this case, the test was right. And about unsupervised machine learning. Well, the unsupervised machine learning, the robot wants to cluster things. You know, in these pictures that we can see that all the same actors that are George Clooney, he does not know who is George Clooney, but the computer can understand that these 4 pictures are from the same person. So he can cluster data from different images. And the reinforcement machine learning is where we use for self-driving cars, for Tesla, for example. This example, very simple example that we did from this very simple game that in Google, when we don't have internet, you can play this dinosaur game in Google. So we teach the machine learning, we teach how to play this game. So we give the machine learning, the computer some goals. The goals is to go as far as he can. And then we did lots of iteration. We did lots of generations of dinosaurs, as you can see here. So the dinosaurs here are trying to reach as far as they can. They don't know where to jump. They will jump randomly. So by far away, and then we give gifts for the generation of dinosaurs that are better. And then we do another arrangement. And then we can teach, for example, with thousands and millions of generations, how to play a game, for example, and how to give a perfect score in a game. And that's very interesting from the machine learning. This is another example of machine learning we can use from cars. So we have a very simple game. From the car must go all around the circuit, okay? And he must go forward, left, and right. And so we did lots of generations. For example, the first generation of the car doesn't even move. He goes randomly. And by the generation by generation, we do that iteration lots of times until we can have our cars to reach the far away it possible, doing it millions and millions of times. That's the power of machine learning. That's the power of the new generations of cars that we have just created. Sorry about that. I think we have a problem here, but let's continue. So with machine learning, we can identify a complex iteration in data. We can classify data. We can identify important contributors and associations in data, and we can predict results. And we are using machine learning everywhere: Netflix, Google, YouTube, everywhere there are machine learning. We have lots of examples in medicine, and we are using now machine learning to predict how a patient will be after a total shoulder arthroplasty. With 19 inputs, with 19 data that we give the machine learning, we can understand how the patient will be in the future with a reverse and an anatomic total shoulder. We did this with lots of data from a single implant. It's the Equinox Exatec Equinox implant. And with some data that we give the machine learning, for example, age, gender, how is the range of motion of the patient prior to the surgery, we can predict how the patient will be in different ways. For example, how the active forward elevation will be from the patient in the post-op, even in different timestamps. I can predict how much he will be in 6 months, 9 months, 1 year, 2 years. All these are predictions specific for that patient, and also the complications for that patient. And these are not complications for the procedure. It's the complications and the result for the procedure for that specific patient itself. That's the power of machine learning. So this is what we call active intelligence, that we can do and personalize predictions about the future of a patient. And looking ahead in the future, looking far away from what we can see, what we are going to see in the near future: clinical and diagnostic. This is a machine learning that I have tested. I give this machine learning some information, some medical records, for example. And now I'm asking this robot some questions. For example, if you give lots of information of a patient, or if the robot has all the medical records for a patient, for example, you can ask this robot if this patient had previous surgeries. You can ask this robot how the patient was on 2010. We can ask the robot how the patient was on 2014. How was his pain? We don't need to remember that, because this machine learning, this robot, knows everything about this patient. This example that we did with a very small medical record, invented medical record, and then we can see how the robot interprets that medical record. For example, another example. I'm asking what arm I have pain, and he understand that my pain is in my right arm, not in my left arm. Understand how much I can elevate. And with diagnostic, this is a machine learning that we did for diagnostic pneumonia with a friend of mine, orthopedic colleague. We gather lots of X-rays from child. His wife is a pediatrician, so we train a machine learning to give diagnosis of pneumonia. This is example of retinopathy from eye to give the diagnostic of problems in the retin, the eye of the patient. This is an example that I did, a code that I did to understand the cuts from a CT scan. This is a CT scan from a shoulder. Now I'm identifying all the parts of the CT scan. So I'm quantifying the muscle of this patient, I'm quantifying the bone, I'm quantifying the amount of fat, and then we can train this robot to understand how much fat this patient has in muscles and anything else. We can grab data from many sources. This is one of the sources that we can grab data to train a machine learning for knee arthritis. And are we teaching the machines? Probably yes. I think in the future we're going to teach machines to perform surgery. Here is an example of general surgery, endoscopic surgery, that the machine predicts where you should go. And this is example how we can do for arthroscopy. I think in the future, for example, in arthroscopy, the machine learning can predict that you are near, for example, an axillary nerve or near a axillary artery, and he can tell you, he can alert you that you are near something important, for example, the brachial plexus. And he also can teach, for example, the direction, the perfect direction to put a screw. This is a very simple example of putting a suture anchor. So you can have a life using the machine learning. The machine learning can always tell you what is the perfect angle to put, for example, a screw or an anchor, or the location, for example, for the screw in a lateral procedure. We can train the machine learning to teach us exactly the location. So that's it. That's my vision for the future. Thank you very much for this opportunity. Bye-bye.